Hello, everyone, and welcome to Novara Live. I am your host, Dalia Gebrial, and I'm going to be joined later in the show by fan favourite Helena, aka NoJusticeMTG. What are we talking about tonight? We have an original investigation into a private mental health provider to share with you. Labour MPs are having a hard time defending austerity with the red rosette, as they should. And we'll look into why the EU is so scared to stand up to Donald Trump. For our first story, we have a Novara Media exclusive. But before we get into that, I want you to imagine this. So you're suffering an acute mental health crisis, one requiring hospitalization. You're in complete despair and in perhaps the most vulnerable position of your life. But instead of being put into the care of the NHS, you end up in the hands of a for-profit private company. You're hoping for compassionate and effective treatment to help return you to your former self. But instead, you get this. I received no treatment whatsoever. From the minute I was brought to the ward to the moment I left, I received no talking therapy. It was like a holding cell. I was sedated on a whole cocktail of medication where I had no say in what I was taking. Those are the words of Hannah, who was admitted to a Priory Group hospital when she was 22 while in the throes of a psychotic episode. And that's just some of the testimony included in this investigation into alleged mistreatment of mental health patients by staff at corporate healthcare provider Priory Group's hospitals, written by our very own Harriet Williamson. Now, that wasn't Hannah's first experience with the private healthcare provider. 6 years earlier, when she was just 16 and suffering from severe anorexia, she'd been admitted to a different Priory Group hospital, spending over 18 months in the institution and without being able to go home for the first year. For the first few months, she told Novara Media's Harriet Williamson, I wasn't allowed outside. In response to Hannah's claim about the lack of therapy, the Priory Group said that at the time, the hospital team included a range of specialists, a therapeutic timetable, and a therapy team which encouraged engagement at sessions specifically designed for the patients, including fitness, art therapy, and group therapy. However, neglect was only one element of the bad treatment that Hannah says she endured at the hands of Priory staff. Novara Media reports this on how she was treated when she was just a teenager. Hannah describes being restrained and forcibly tube-fed by staff 4 times a day for approximately 14 months. A spokesperson for the Priory says that force feeding and restriction of movement can be necessary in cases of acute eating disorders. But Hannah experienced it as traumatizing. It was very rough and done with very little compassion or explanation of what was happening to me. Staff would repeatedly refer to me as my room number as opposed to my name. Room number 9, you need to go for your medication now. Or room number 9, you haven't done this. It's beyond dehumanizing. Now, a Priory spokesperson said that this is, quote, not the practice we would ever expect to see, and that both sites referenced are rated good by the independent regulator and practice is routinely subject to audits and assessments internally. Hannah's testimony nonetheless continues. Within those walls, you're just a diagnosis. They don't see you as a person with a life and so much more to you than that. And when you're in there for so long, you start to believe it too. Now, if you've never heard of Priory Group, let me fill you in. So the company operates hospitals and treatment centres at hundreds of sites across the UK with more than 7,000 beds between them. Many of those hospitals are housed by grand historic buildings set in lush grounds. Now, of course, there's nothing wrong with that. All patients deserve to recover in beautiful and calming surroundings. Though, of course, external appearances can be deceiving. But Priory hospital care is also very expensive. They charge thousands of pounds for inpatient care. And if you're an NHS patient, then it's the health service that foots that bill. This is from the Novara article. In 2024, the NHS spent more than £2 billion, 13.3% of its total mental health budget, sending mental health patients to private hospitals. This was £279 million more than in 2023. The biggest beneficiary is the Priory Group, the largest private provider of mental health services to the NHS, with 290 facilities across the UK. Next is Signet Healthcare. Between them, the Priory Group and Signet account for more than 68% of the NHS spending on private mental health hospitals, according to healthcare consultants Langbuson. With an annual turnover of over £700 million, over 90% of the Priory Group's revenue comes from the British taxpayer, which pays handsomely for its services. According to Langbuson, the NHS pays up to £786 per day per patient for a private bed in a secure unit, amounting to more than £286,000 a year. According to former patients, though, that money is not only wasted, but actually spent on making them sicker. In the article, Hannah makes this connection between her 2 stays at Priory Group hospitals. For her, being an NHS patient at Priory Group Hospital makes you madder, she says. As well as the deep scars of trauma it gives you, it takes you away from all the things, including the community of family and friends, that are integral to supporting me to be well and stable. In fact, Hannah partly attributes her readmission to the hospital in 2021 after experiencing what she describes as a psychotic episode to her first experience at a Priory Group hospital. The fact that I was hospitalised later as an adult, and a lot of the reasons for that came from my time in a Priory hospital when I was 16 and 17, she explains. I felt like I was back in this prison of all of the things that made me unwell. I couldn't leave for 6 weeks with all the triggers and reminders of where my trauma had come from. It was horrible. My Gebrial was also a patient with the Priory Group, having been admitted to 4 of their hospitals between the ages of 14 and 29. Mai, who has a complex case history involving OCD, depression, anxiety, and attempted suicide, has also experienced Priory hospital treatment as both an NHS and a private patient. They told Novara Media this. The difference in the standard of care I've seen between private Priory wards and NHS Priory wards is stark. Unless you have the money to pay privately, you will receive no treatment. You will just receive drugs. In my 3 admissions to the Priory Ticehurst, which is a Priory Group facility in Sussex, not once did I speak to a therapist. Care for NHS patients is awful. Your main contact is with healthcare assistants. They tend to have done basic online training, the mental health component of which is very, very minimal. So they don't have the skills needed to deal with people in crisis or just to deal with anyone with neurodiversity. In response to Mai's allegations, Priory Group said this. Private mental health care is typically for patients with lower acuity conditions who are not detained under the Mental Health Act or cared for on a secure ward. Whether you are an NHS or private patient, the same clinical standards such as NICE guidelines are followed as appropriate for a patient's condition. Now, according to Mai, who is neurodivergent, the treatment they received was well outside of the NICE guidelines. They told Novara this. I was put in a face-down restraint while having an autistic meltdown because I was sitting in the corner of my room and they wanted me off the floor. So they dragged me onto the bed and restrained me. They were agency staff who didn't know how to handle it. I was just sitting in the corner, rocking back and forth, listening to music. I've been restrained by 5 grown men before as a 15 or 16-year-old. In response to that allegation, Priory Group said that all staff who support patients receive comprehensive training and that agency staff receive, quote, equivalent induction training as substantive staff. It's worth noting that statutory guidance states that restraint is sometimes necessary to secure the safety of patients and staff, but that it should only ever be used proportionately and as a last resort. The improper use of restraint has been documented in Priory hospitals across years of Care Quality Commission reports. And in response to both Mai and Hannah's claims regarding over-medication, Priory Group say that all medications, including benzodiazepines, are prescribed by a qualified medical professional based on a patient's medical need and regularly reviewed. Both Mai and Hannah are now activists working with campaign group Mad Youth Organise, and they're taking aim at what they believe are the societal causes of young people's distress and the corporations profiting from it. Earlier today, I spoke to Novara Media's Harriet Williamson, who wrote the investigation, and I began by asking her to describe Hannah and Mai's treatment by Priory Group.
I would characterise Hannah and Mai's treatment as degrading, as traumatising, as something that really stripped them of their personhood at a time where they were at their most vulnerable and most in need of compassion and care. I'd also like to pay testament today to the bravery of Hannah and Mai in coming forward and telling their stories about their experiences within Priory Group facilities. I think it's worth highlighting that Hannah has experience of 2 different Priory Group facilities, while Mai was an inpatient in 4 different facilities, all owned by Priory Group, and that their experiences were so deeply upsetting and have ingrained themselves into the consciousness of both young people to such an extent that they have put their energy now as adults into Mad Youth Organise, which is the activist group that staged the die-in outside of Priory Roehampton, which is the flagship facility in London.
I mean, it seems absolutely shocking to me that the NHS is spending this much money on a company that's providing this kind of standard of care, which in your words is dehumanizing, and the way that you describe it in the piece. What is your take on this?
I think that one of the things that it's really important for us to reiterate is that the NHS's own capacity for inpatient care has really dropped. I mean, between 1998 and 2019, so that's nearly a 20-year period, the NHS's inpatient capacity in terms of beds has halved, and the private sector's bed capacity has doubled. And that does not make up entirely for the shortfall in NHS beds. The NHS does not have capacity within itself to provide care for all of the people who are in acute stages of mental health crisis and need an inpatient stay in a facility. The private sector is picking up some of that shortfall, and unfortunately, when you introduce a private provider into this, into something as sensitive and as as humanly important as people's healthcare, it becomes driven by the profit motive, and that's where problems really, really do start to occur. And I think we need to remember that all of this money that is going to private providers like Priory Group from the NHS is coming from the UK taxpayer. So we are paying for young people like Hannah and Mai to have these really devastating experiences that they might follow them for the rest of their lives. And yeah, it's coming out of our pockets.
It's like they have gone into, they sought healthcare and instead they got an experience that actually compounded the core reasons why they were unwell in the first place. I mean, you came to this story off the back of an action by Mad Youth Organise, which you referenced in your answer there. Could you tell us a little bit more about the organisation?
So Mad Youth Organise is a youth activist collective. It comes from quite an anti-capitalist standpoint. It's the reason I was really interested in covering it is because during Children's Mental Health Week, you often get a lot of sort of pundits and maybe like mental health influencers taking a very individualistic approach to mental health. It all sort of revolves around telling personal stories and speaking up for awareness or asking for more funding in different areas. It doesn't actually go to the material reasons why young people might be experiencing mental distress. And, if we look at young people's lives, if we look at things like 0 hours contracts, the lack of decent work out there, the climate crisis, years of austerity, the impact of COVID, and then something that I really hate bringing up, but they have to say it, social media is part of it as well. Is it any wonder that young people feel so hopeless, so distressed, so disliking of themselves, so isolated from each other in many cases? And the fact that Mad Youth Organise was actually taking a sort of wider and politicised look at the causes of mental distress and taking action to corporations that they feel are actually profiting from and causing emotional suffering. So during Children's Mental Health Week, they protested outside of not just Priory Roehampton, but the headquarters of Meta in London, the House Building Federation, and Shell, just to name a couple of targets. So it was a really holistic, wider, and not focused so much on the individual and individual diagnosis and labeling approach to mental health. Because I think when we look at a lot of people suffering, particularly young people like Hannah and Mai, we might find that their feelings of distress, of hopelessness, of pain are entirely understandable given the material conditions that they're existing within.
So what are the challenges that people like Hannah and Mai face when speaking out about their treatment in places like the Priory?
Well, I think that one of the real issues that people who've received a mental health diagnosis or treatment, particularly in an inpatient setting, face when they're speaking out is that their voices are so often just discredited because they're already seen as quote unquote mad and like they shouldn't be listened to, or that their testimony is not reliable. But what I found from interviewing both of these young people and working with them was that they were incredibly articulate, incredibly willing to share these really difficult experiences and be incredibly courageous in doing so, because they felt they had a duty to speak out and make people aware of the kind of treatment that goes on in private healthcare facilities like Priory Group behind closed doors. And I mean, there is plenty that is a matter of public record, and I detail a lot of it in the piece in terms of the tragic deaths that have occurred on the Priory's watch and the hundreds of thousands of pounds that Priory Group have been forced to pay out because of these really, really tragic deaths. But I think that what if anything could come of this piece, one of the things that I would really like it to be is that we don't just discount the experiences of people just because they have been within an institutionalized healthcare setting. And I also think it's really important to highlight the fact that these two young people went into Priory Group at a time when, as I've said, they were incredibly vulnerable. Their parents were crying out for them to get the help that they needed. And I don't know about anybody else who has read this or is listening to this now, but you could be the most well person in the world and go into that setting and be treated in this way and feel completely mad and unhinged because the way that they were dealt with and the lack of compassion shown and the violence, the way they were the way both young people report being restrained physically and sedated, I think that is enough to make anybody mad.
That was Novara Media's Harriet Williamson speaking to me earlier today. Responding to Novara Media's report on Priory Group, a spokesperson said this: "These reports contain serious factual inaccuracies and unfounded allegations, which we dispute and have challenged. However, we take any concerns raised about our services extremely seriously and would encourage the patients involved to contact us directly so we can investigate fully, involve them in the process, and provide a full response. We are regulated in the same way as NHS providers, with 86% currently rated as good or better by independent regulators. This is above the national average, which includes NHS services. With regards to costs, it is inaccurate to suggest that the independent sector is more expensive than the NHS without understanding the full cost to the NHS of providing the specialist facilities and staffing to support increasing numbers of complex acute mental health patients across the country." Our investigation in Priory Group comes hot on the heels of a string of controversies involving the corporate healthcare provider. In 2022, The Times published this investigation into Priory Group's failures of care involving 30 patients who later died. It details the catalogue of errors that led to repeated criticisms of the group by healthcare professionals and NHS managers over a decade. That number is now even higher, with at least 44 deaths of vulnerable people recorded while in the care of the Priory Group. And one of those who died was Matthew Caseby, who was hit by a train after running away from the Priory Hospital in Woodburn. Priory Group was later fined £650,000 after they pled guilty in court to a criminal safety failing in his care. That trend in Priory Group patient tragedy continued into 2023. 3 women died at Priory Hospital, Cheadle Royal, near Stockport, in just 2 months. Priory Group told the BBC the deaths were unconnected, though coroners in 2 of the instances found the care of the patients who died was inadequate, though only 1 ruled that neglect had been a contributing factor. Things continued to go downhill for the Priory Group that year. That's after two former senior managers blew the whistle on the group over patient safety, saying they were under constant pressure to cut costs, leading to patients being placed on wards that did not have staff equipped with the skills to handle their conditions. But these documented failures at the Priory Group are only a drop in the ocean of mistreatment dealt to patients when private capital gets involved in healthcare. And there's big money, massive money to be made from exploiting the care demands of our population. Take residential care, for example. This is from a recent London Review of Books article by Novara Media co-founder James Butler. He says, the residential care sector has an annual income of £15 billion, half of which is public money. Care chains, families, and trade unions are united in arguing that austerity wrecked their capacity to deliver good care and that the state underfunds the places it pays for. This much is evident. It isn't the full picture, however. As the Centre for Health and the Public Interest puts it, the sector is leaky. 10% of income, £1.5 billion, goes on rent, dividends, director payments, debt servicing, and profit. And maybe that's just what private businesses do. But the details are troubling. The CHPI points out that the largest 26 providers spend £261 million on servicing their debt, 45% of which flows to related companies, many of them offshore. Despite posting an £83 million loss in 2021, private care home company HC1 paid one of its directors £592,000. Now, that HC1 payout is also a great example of the relationship between private healthcare and our political classes. This is Money reported this in 2022. The package is thought to have gone to Chief Executive James Tugendhat, cousin of Tom Tugendhat, the MP running to be the next leader of the Tory party, though HC1 did not disclose the recipient in its accounts. I'm joined now by David Rowlands of the Centre for Health and the Public Interest. David, thank you so much for joining us. David, can you begin by outlining for us how private companies have become so dominant in the care sector?
Thank you. Yeah, it's a really long story in a way, but I'll try and keep it brief. Back in the 1980s, Margaret Thatcher's government sought to move whatever provision existed in both the NHS and within local government into the private sector. And that was achieved through, in a sense, restricting the amount of capital available to local authorities to maintain their own care homes. So what you saw was probably about 30% of the provision at the time was run by local authorities. They weren't able to maintain those care homes. And so as a result of that they were transferred into the private sector. In addition, you had a lot of older people who had been treated in NHS long-term care wards, which wasn't great. There's no doubt about that. But those those long-term care wards were closed down. And then there were incentives provided to the private sector to actually start building and taking on those individuals. Fast forward to when New Labour came into power, that trend very much continued, restricting the capital available to local authorities to maintain the care homes that they owned and operated. And so as a result, more care homes were shifted into the private sector. And then subsequent to that, you also saw under New Labour a big shift away from local authority provided domiciliary care, so care services that people receive at home, into the private sector. So it's at the start of the 1990s, it was about 10% of the domiciliary care sector was provided by the private sector. By the end of the time that New Labour ended its term in office, that was close to 90%. So it's something which has been part of the agenda for political parties of all colours. It's never really been debated, not only whether or not it should be the case that private capital should be used in order to provide services to these vulnerable people, nor has anybody really asked the question, what type of providers do you want running these services. So whilst it is the case that around 2/3 of the care home sector for older people are run by smaller care homes operators, so families, mom and pop type kind of outfits, as well as the not-for-profit sector, 1/3 are run by companies which are generally owned by private equity investors or other offshore registered entities.
And, you know, what really strikes me about this is how lucrative care is as an industry, how expensive it is. I mean, we've seen these numbers from your organisation that £15 billion goes into the private residential care sector. Half of that comes from public money. We also know anyone who's had to pay for private care knows that it's so expensive to pay out of pocket. So there can't be an argument that there's not enough money. And yet the standard of care is so poor. So where is all this money going?
Yeah, I mean, that's a very good question. So, I mean, we've done this research. There's a couple of other organisations that have sought to understand this as well. But generally speaking, government does not know where the money that it pays into the adult social care sector, or indeed most of social care, actually ends up. It has very poor monitoring of where money goes. There's very poor auditing of the accounts of the companies. A significant proportion of the companies that are providing these services, you can't even get their profit and loss account. So it's very difficult to detect and understand where money's going. Now, I think it's really important to understand that, yes, the amount of money which is going into social care is insufficient. There is definitely the case that there is not enough money which is being made available to care for people. And I think it's also important to remember that when we're talking about people paying for themselves, it's not like people are paying for themselves in the way that they pay for private education, or if they choose to potentially use their savings to jump the NHS queue. People are being forced to pay for residential care because of the fact that there's an eligibility criteria which is established, which says you don't get care unless you're very, very seriously in need. Sorry, you don't get state-funded care unless you're very seriously in need, and you don't get state-funded care unless you have assets below 23,500, which means that most people who end up going down that route are now increasingly being forced to pay. And that's problematic when you've got companies that are, as we described in our report, taking a significant chunk of the weekly fees that are paid by individuals and by the taxpayer to go towards profits, dividends, payment of rent to landlords, management fees. £200 million in management fees leak out of the system every year. That's £200 million, which goes absolutely nowhere near a care worker or an older person receiving care.
And obviously, there's a problem here with one of the main reasons why we oppose the privatisation of care is because of the profit motive, right? Introducing the profit motive into the care relationship. Can you summarise what impact in kind of concrete terms that the profit motive has on the standard of care provision?
Yeah, so in the UK, it's actually pretty difficult to say quality of care is impacted by profit because, as I said, we don't have the data sufficiently available to us to actually do an analysis of the actual finances of the care home companies. And also, when in your last report you cited CQC data, our actual data on quality of care within most aspects of health and social care is very poor. But if you look at the US, where we know that it's possible to identify both the quality of care and also the finances of the companies that are delivering those services, you see a very significant difference between the types of provider, so whether it's not-for-profit, for-profit, or private equity, and the quality of care. And it's pretty obvious, really. If you've got a significant chunk of the amount of money which is going in to look after an older person, which is going to profit, or which is going to repay debt or is going in management fees, that leaves a smaller amount available to pay care workers. It provides a smaller amount which is available to provide facilities, to provide the types of things which make life in a care home bearable. So taking people out on day trips, providing them with good food, etc. And we don't have that much data on this, as I explained, but we did a study looking at the impact of COVID on the finances of the care home sector. And what we found there was, even during the middle of the public health emergency that we all experienced, and the care home sector was worse hit than anywhere else, there were still companies that were paying out more dividends during the first year of the pandemic than they did in the year prior to it. Actually, they increased the amount of dividends that they paid out by about 11%. Now, all of that money that was going in to the care home sector at that time was money that was coming from the taxpayer to keep these providers going. And our research found that when you looked at the difference between how not-for-profit companies responded to the pandemic in terms of how they looked after their staff, the amount they spent on staff compared to for-profit ones, you saw a huge difference.
And I mean, we know that generally the public, the electorate, so care is a very important issue to them, and their satisfaction with care, social care in particular, is really low. 57% feel that worker pay and training is inadequate. 56% say that they don't receive the social care that they need. So what is actually stopping politicians of all stripes from sorting out this issue, which is so high on the agenda of so many voters?
Well, I mean, it's a very good question. I've been studying this area for about 20 years, and I think there's a number of factors which lie behind it. First of all, I think it's without doubt we exist in a society which treats older people as after they get to a certain stage of need and frailty, as people that can be ignored and become hidden. And we don't like talking about old age generally as a society. We'd like to focus on young, active people who are vocal. And I think there's a massive issue with ageism within the society that feeds into this problem. And secondly, there's also a big debate that's yet to be resolved, which is, how do you fund and finance the provision of care for people in these circumstances? Whether that should be something which is passed back to the individual, as is increasingly the case. So there's 140,000 people currently in care homes who are paying for themselves, or whether it's something which should be shared collectively. Now, if it's going to be shared collectively, then there has to be a commitment on the part of policymakers, cross-party consensus, however it's kind of described, to actually ensure that there's sufficient amount of money which is raised through taxation to pay for it. And I think unless we get to a situation where, one, we kind of move on from the sort of the ageism which, impacts this debate and this discussion, and two, we have a much clearer idea about what our collective responsibilities are in terms of funding and financing care services, we're going to continue to see two things. We're going to see a decline in the quality of care, and we're going to see an increasing amount of profit extraction by companies, which generally speaking can get away with whatever they want because they're not subject to the type of monitoring which is absolutely necessary.
David, thank you so much for joining us today. That was really, really clarifying.
Thank you.
Yeah, and I mean, it's worth thinking about how that ageism that David mentioned is really related to the disability cuts that we're seeing Labour pushing through. Both of them rely on this very capitalist logic that if you are not, quote unquote, economically productive because, you're old, so even if you've worked your whole life, but once you hit a certain age and you can no longer be economically productive, or if you are disabled, and we live in a society that makes very few accommodations for disabled people, and so they become they become classified as economically unproductive, that you lose your value as a human being, that you are just worthless. And the idea of privatizing care for elderly people, for disabled people, is a way of finding a way to financialize their existence. Because if you can't exploit them as workers, then you can exploit them as people who need support and need care. None of that is about the actual well-being of the people that are supposed to be taken care of in these systems. And, you know, care is a huge industry in this country. There is a massive care crisis. We have an aging population. We have a society that makes people very unwell. We have a disabling society. And we have, you know, a relatively, despite the cost of living crisis, we do have a relatively big consumer market in this country. And that's why we, you know, if at one point in our history, manufacturing was the core of our economy, now I would say that care and the care crisis is increasingly the core of our economy. And the calculation that a lot of these huge companies, these financialized companies, these private equity companies are making is that there is a generation of older people, you know, boomers, who have some assets, who have, you know, fairly big assets in terms of housing, you know, people who bought houses for a very low amount in, you know, the 70s and 80s. Now those homes are worth loads more. They are banking on the idea that when those people need care, they can't be cared for by their children or by, you know, typical kind of care communities because their children live far away. The cuts to PIP, the cuts to benefits also means a reduction in caring allowance. So people can't afford to care for their loved ones. They can't rely on these traditional care networks. And so they're going to be forced to rely on care that is provided by these private contractors, and they have made the calculation that they will become so desperate for it that they will refinance their homes, and all of that asset wealth, the remaining class of people who have some asset wealth in this country without being the super rich, will then be sucked up and redistributed to the financial elite, to financial classes. So, you know, those they won't be able to pass down those assets to their kids who are unable to build their own generational wealth. They won't be able to do any of that because they're going to have to refinance their homes in order to be able to afford basic care, which should be an essential human right that is provided by the state. Why should it be provided by the state? Because every penny that we pay into our care system via our taxes should go into paying care workers, training care workers, doing all of the things that people who deserve when they are in a care system, and not to servicing debt and provide and paying out shareholder dividends. Because let's not forget, this isn't about the morality of these companies. This isn't about these companies need to be held to account to be more moral or whatever. The job of a private companies have a fiduciary responsibility, a legal responsibility to maximize profits for their shareholders. And anything they do that does not result in maximizing profits for their shareholders is them violating that responsibility. And so in the context of a care system, what does that mean? It means underpaying workers. It means exploiting workers. It means not providing workers with proper training. It means not investing in resources, not investing in the things that people need to have a good care relationship. And that means that all of that wealth redistribution comes from us via our taxes and, as I said before, our parents, our grandparents refinancing the small number of assets that they might have in order to pay for their care, rather than handing those assets down to a younger generation that is struggling to make ends meet because of our broken economy. So it's really like the logic of a market is totally incompatible with the logic of decent care. And it's irreconcilable in my opinion. But before we move on, we have a little announcement to make, which is that Novara Live is currently hiring. So if you've ever wondered what things are like behind the scenes, what it's like to work on this show, now is your chance. We're looking for an additional live stream producer to join our team and help us expand the production. The ideal candidate would have demonstrable experience in live broadcasting environments, as well as strong knowledge of left-wing politics and current affairs. So if you want to work with me, with Aaron, Ash, Stephen, the whole gang, make sure you find out more by going to the link in the description, which is underneath this video. Labour MPs just can't stop embarrassing themselves as they struggle to defend implementing some of the worst disability cuts this country has ever seen. Here's MP and Chief Secretary to the Treasury, Darren Jones, on Politics Live.
Just had the impact assessment has just dropped. Now, the average loss for someone on the personal independence payment is £4,500 a year. That's significant, Darren.
I think so I've not seen the impact assessment because, as you say, it's just been published. But my understanding is what the impact assessment doesn't account for is the benefit that you get from our additional money into support for training, skills or work. So take for example, if I said to my kids, I'm going to cut your pocket money by £10 a week, but you have to go and get a Saturday job. The impact assessment on that basis would say that my kids were down £10, irrespective of how much money they get from their Saturday job.
Wow. So comparing disabled people to children that you need to discipline to teach them the value of money. This isn't about incentivizing. Like, we know that cutting these PIP, so as many of you probably know, either because you yourself are on PIP, someone you love is on PIP, or you've read more into it because of this story. Basically, what the Labour government is proposing is that you cut PIP for people who don't reach a certain threshold. That's always been the case. There's always been a threshold for receiving personal independence payments or any kinds of disability benefits. And they have basically massively increased that threshold. And what that means is that people who aren't able to use the bathroom independently or aren't able to dress themselves independently are now going to be considered well enough to go to work, and not just go to work, but earn enough money to cover all their basic needs, to live a decent life, which those of us who are able-bodied are even struggling to do. And so the idea that Darren Jones it's so condescending, it's so moralizing, it's so it's so lacking in dignity to compare people who require that extra support, to compare them to your children who you're disciplining with pocket money. I mean, it's absolutely disgusting. And unsurprisingly, Darren Jones has been on the apology tour, although I have to add, not for justifying slashing support for disabled people during a cost of living crisis, but for failing to cover up his condescending disdain for those people through his choice of language. And here's MP Dan Tomlinson also letting us know why the disabled, rather than the uber wealthy, should be footing the bill for this country's finances.
I don't know what changes are coming down the track on tax or spend. That's not for me to speculate about. We will see later in the year.
Would you like the wealthy in this country to pay more tax than they currently are?
I think we have to make sure that we don't try and raise revenues from the wealthy and then their wealth just disappears overseas and we all
So because
end up
disabled people can't move their investments, they're the ones that have to foot the bill.
Look, Ben, that is not fair, because as I have explained to you, this modelling today doesn't take account of the fact that our changes, we are confident that, £1 billion extra in employment support, making sure that we're there for people when they need the support. And look, let me be clear, there are many people who have sickness and disability that mean that they cannot work and they will not be able to work in the future. We will make sure that our benefit system protects them.
So to me, I mean, there's no talking point that I hate more than, well, we can't tax the wealthy because they might leave. Why do we never worry about anyone else leaving or anyone else being dispossessed or anyone else being troubled other than the super, super wealthy, who more often than not, the amount that we're talking about, I mean, we're talking about like a 1% tax on the very, very rich, could, like, a one-off 1% wealth tax would raise billions and billions of pounds. I believe it would fill the NHS funding gap but for 5 years. So we're talking about like a minuscule impact on their on the amount of wealth that they barely even notice it when you're that rich. They're so worried about upsetting wealthy people, the uber rich, an even tiny amount. We never worry about what about these, all the people, all the junior doctors who are leaving the NHS, all the nurses leaving the profession, teachers leaving the profession, all of that. No worry about that. Absolutely fine. But let a billionaire threaten to move their assets out of the country, which, by the way, most of their assets are already in offshore and are already offshored and are actually not really contributing to the British economy. But then when it comes to disabled people, they should be tolerating whatever we throw at them, no matter how humiliating, no matter how degrading, because they are, I don't know, not as important. I mean, it's very clear that disabled people to the Labour Party, unfortunately, are worth a drop in the ocean compared to the super, super rich. Because when it comes to this balancing the books, they're not willing to just take a 1% wealth tax, which would dramatically transform this country's finances, to people who are billionaires, but they're willing to take away the meager amount of money that people who, again, can't use the bathroom independently, that they rely on to live a dignified life. Now, both of those clips show the direction that Starmer's Labour have gone in. And this is wildly unpopular with Labour's base, but it's also out of step with the general public. Despite ample attempts to demonise people on benefits, just 7% of the British public believe people who have a disability receive too much support. 48% believe they don't receive enough, and 29% believe they receive about the same amount. So that means that probably only that 7% will agree that disability benefits should be cut. Now, one person who probably is in that 7%, someone who is pretty happy with Labour's disastrous welfare policies, is Reform leader Richard Tice.
We've got to dramatically cut huge amounts of wasteful spending and get people back to work. Way too many people have made the calculation that it's better to claim welfare, and the welfare budget is completely, utterly out of control. Work is a great thing. We've got to make work pay.
Do you agree with Liz Kendall that cutting welfare for people on incapacity benefit is a good way to get people into work?
You've got to cut welfare for people who shouldn't be claiming welfare because they've decided to sit at home on their backside as opposed to getting up and going out to work, which is what most of us do, and paying our taxes. It's too easy for too many people who are perfectly healthy not to go to work and to claim welfare. Of course, we want a world-leading benefit system that looks after the genuinely disabled who can't work. Many wonderful disabled people want to work and do work, and that's fantastic, and they should be supported. Look after the genuinely vulnerable and those who are genuinely looking for work. What you don't do is pay the idlers and the skivers to sit at home. That's how you save tens of billions a year.
So that's the vote and the mentality that the Labour Party is courting, calling people on welfare, where, by the way, after 10 years of austerity, the threshold to access welfare is really high, really high, higher than it's ever been. And Labour are what Labour is doing, Labour's programme is pleasing a man who refers to those people, ordinary people, as idlers and skivers. Meanwhile, if you want to talk about making work pay, you want to talk about people need to work and, work is good and that we need to reward work. I said this on last week's show and I'm going to say it again. If you have £1 million sitting in an investment portfolio, like a regular savings investment portfolio, and you do nothing, you just leave it in there, that money will make 40 grand in interest over 1 year. That's more than the average salary of a nurse or a school teacher in this country. So if you want to talk about people sitting on their backside and not getting up to work, let's talk about the millionaires and the billionaires and the asset strippers who make money precisely from sitting on their backsides and watching their interest going up for doing absolutely nothing. But those aren't the people that Reform, and unfortunately this iteration of the Labour Party, are going after. And that tells you everything that you need to know about the grift that is Reform UK. Because their sell to the British public has been, we need to cut immigration to free up resources to spend on the services that people need. So why would they then support cuts to those very same services? If it's really about, oh, close the borders, we need to care for our own, why are they supporting cutting off vital support from the disabled who are amongst our own? Because when you focus everyone's attention on immigrants, it allows them to appear populist whilst distracting from the thing that they actually are setting out to do, which is to slash the welfare state for everyone and hand off whatever is left to private contractors. Reform will never actually come out for properly investing in a truly public service or a wealth tax on the super rich, because they are bankrolled by the super rich. When you look at their donors, this is a party by billionaires and for billionaires. And billionaires generally don't invest in political projects unless they think they're going to get a return on their investment. And that return on their investment comes from tax cuts for them, not relatively for the middle class, because they still need to raise money from the middle class in order to service those big private contracts from the state. They also want a return on their investment in the form of slashed employment law. So basically meaning that your employer has more power than ever to, for example, fire you if you refuse to fire you and then rehire you on a worse contract. So it's not actually a surprise to anyone who is genuinely paying attention that this is where reforms stand, because when you scrutinize their actual policies and the actual interests that they represent, rather than just listening to all of the populist bluster, you can see what they actually represent. Now, the circle that I can't square is why the Labour Party, who were elected on the basis of investing in public services, the thing that will actually improve people's lives and provide some firewall against this lurch to the far right. Because for a lot of people who are against immigration, where immigration is leading in this lurch to the far right. Look, some of those people are just ideologically opposed to people who are different to them. Like in some cases, that is it. For a lot of them, it's because they have been told that immigrants are the reason that they don't have access to public services. So they have been told that over and over again by our media and by so many of our politicians. And so they're like, okay, well, if closing the borders is how I can make sure that I'm always going to have a home to live in, even if something happens, I become disabled, I lose my job or whatever, I'm not going to end up on the streets. Or if cutting immigration means that I'm going to be able to see my GP, fine, that's what I'm going to do. That's what I'm going to believe in. And the fact that the Labour Party would agree with reform on those terms and show all of the ways in which, and instead of showing all of the ways in which reform are using immigration as a smokescreen for their pro-billionaire economic policies, they're choosing to take on the parts of a reform agenda that will be the most harmful to the working class. Helena, welcome to the show. We didn't introduce you at the beginning, but we're so happy to have you now. What do you make of this just circus show that is Labour trying to justify why it is going hard for public services in the middle of a cost of living crisis?
Just wanted to expand on a couple of points with regards to Reform UK's position, and also talk about Labour's strategy with regards to how they're looking at policy and how they're looking at winning voters over. So when it comes to the kind of things that Reform UK talk about, when they say we want to incentivise people back into work by cutting welfare, for example, well, first of all, the idea that you can cut welfare to get people back into work, that hasn't really worked in this country. For example, you look at other countries across Europe that have much less punitive welfare systems than we do. They have much higher out of work benefits than we do, and disability payments as well. They actually have higher rates of labour force participation than we do. There's no correlation between the slashing of the welfare state, especially on PIP, which is something that has no work requirement, right? This idea that you can slash PIP to get people into work when a lot of those people are in work and need that to help them stay in work is ridiculous. That's not a successful strategy in increasing labour force participation, even if there were jobs for them to go into, which there currently really aren't. There are more people out of work than there are job vacancies in this country. The statistics just don't add up in terms of how that actually gets people back into work. And they say they want to make work pay, they want to incentivise people into work, yet they voted against the Workers' Rights Bill in the House of Commons. And the fact that they want to support welfare cuts, that's a supply side labour market reform. That is driving down wages. In fact, if you cut the welfare state, it makes work pay less because the companies have to compete with a smaller remuneration for the welfare state for people who are out of work and looking for work, So these supply side labour market reforms are bad for workers because they drive down wages. The Reform UK rhetoric is, well, we want to make work pay by cutting the taxes for working people. And whilst I think that that's reasonable in the abstract, in reality, when you look at the utility of cutting these taxes, say, for example, you raise the basic rate at which people start paying income tax. I mean, even Jeremy Corbyn talked about that on Sky News the other day. In reality, that is for everyone across the economy. It's not just the people who are on the low incomes, because that's a tax threshold that applies to everybody. That's going to drastically reduce the overall tax take that can therefore be spent on public services. And if you're part of that cohort that's in the lower end of the income distribution, any amount of tax cut you get from what you currently pay will lead to a greater reduction in public services that you personally receive, that you have access to and that you utilize, because people who don't use those public services are also having their taxes cut and you're more likely to use them. So this is a really good way of selling people the idea of a tax cut, which looks good on paper, but in reality is better for other people than it is for them because of how much you get back from the state. So the bunch of their rhetoric in terms of how they want to make work pay just doesn't add up when you look at the reality of what it's like for people who are on the bottom or who are out of work or who are disabled, for example. None of these things in reality stack up. When it comes to Labour strategy, right? The thing that's really important to understand is that the people at the top of the Labour Party at the moment, so the people who control the direction of which they travel, is the people who are inside kind of the Starmer's Politburo at the top. So that's people like Morgan McSweeney, Pat McFadden, Rachel Reeves, the kind of people from his think tank friends in Labour Together and the Tony Blair Institute and places like that. These are the people who set the direction and strategy in terms of where they look at policy, where they look at messaging. And there was a quote from Morgan McSweeney in, I believe it was The Guardian earlier this week, where he believes that despite Labour's bad polling at the moment, that when it comes down to it, when the rubber hits the road, a bunch of Labour Party core voters will not desert them for the Liberal Democrats or the Green Party or the Workers' Party or the Scottish National Party. They will go back towards Labour to help keep the Conservatives and Reform out, that they will go back to the tactical voting strategy that was kind of the hallmark of what kind of progressive influencers were talking about in the run-up to the last election. So if you have that in your brain, right, that's your kind of your base level in terms of where you think people are going to vote. Well, you think, well, the only place that I can get votes from is the people that we are losing to Reform UK. The reality, of course, though, is they're actually not losing that many voters to Reform UK. I was digging through the internal numbers from recent polling from a bunch of pollsters, but I'm going to focus specifically on the most recent one from a pollster called Find Out Now, because it shows Reform UK with the largest amount of support. And I was looking into the numbers based upon how people voted at the last election. And in reality, the biggest cohort out of where people voted that is now voting Reform UK are people who didn't vote. It's non-voters that are being attracted by Reform UK for their anti-establishment credentials. Obviously, they don't really exist, but that's how they're being talked about by the mainstream media, and that's how they present themselves. They are marketing themselves as a different kind of politics, and therefore they are trying to bring people in who are in the very large pool of non-voters, because the last election was incredibly low turnout, record low turnout, and that's their shtick. That's what attracts people to Reform UK, and that's how they win these people over. So the Labour Party, who are convinced that they are losing people from their own ranks to Reform UK, actually, I don't think that's very true. I was looking at the numbers, and actually the Labour Party voters who are moving to Reform UK, it's around about 7%. It's really not a large amount. There are double the number of people from this poll that I'm speaking of who voted Labour in the last election who are now planning on voting Green in current Westminster voting intention. So they're not losing voters to Reform UK. They are losing people to other parties, and it's Reform UK who are galvanising people who feel let down by politics in general. And if you are maintaining and you are reifying a zeitgeist that demonises the disabled, that doesn't want to tax wealth, and will talk about all of the same kind of narratives that you get from right-wingers, that is going to shut out of the zeitgeist any alternative viewpoint. If the political consensus throughout the main three parties, who take up about 65% of the current voting intention, if there's no opposition to that, it will become rote. It'll become received wisdom, just like George Osborne's cuts did in 2010, when Gordon Brown, Nick Clegg, and David Cameron all run on pro-austerity platforms in 2010, and Labour Party was subsumed by that rhetoric and ran on it in 2015 as well, under Ed Miliband and under Ed Balls as Shadow Chancellor. So everyone was accepting of the austerity narrative, minus the people who weren't part of the large-scale protests against it. And so that's why David Cameron could win the election back then, because everyone thought, well, he's done a good job with a thing that was obvious you had to do, even though anyone who knows about economics knew that you do austerity in a liquidity trap, you fiscally expand to ensure that you get investment to grow the economy. And regardless, it didn't matter, because everyone believed that to be true. And now with the Labour, Tory and Reform UK all saying that immigrants are the problem and that you should be taking away money from the disabled, the public are going to continue to be led to believe that that is the case. And so not only is it bad electorally to take these lines, because you're not winning anybody over, as current polls show, and you are losing people to your left as well, it also means that the broader Overton window will shift rightwards. And the last thing I want to mention is that this is the fundamental pitfall of the tactical voting strategy from the last election. Labour always odds on to win. They end up with a giant, unassailable majority in the House of Commons right now. So there's no dissent, right? It would take a huge number of rebel MPs to bring down any legislation towards welfare reform. And that's not going to happen now, because these are all people who have been selected as candidates by the Politburo to make sure that they are loyal to the people at the top of the party. They're not going to rebel. And because people all got behind Labour, who said tactical voting was a good thing, a bunch of the MPs that might theoretically be flirting with rebellion know that they don't need to, because they have a big cushion in terms of their majority behind a progressive challenger. If there were more people out there threatening not to vote Labour, or said they wouldn't vote Labour if they went to the right, rather than saying that they would give away their vote regardless of how right-wing they are, there's no incentive for Labour to try and court their votes anymore. And rebel MPs know that they don't have to worry about losing these votes anyway, and they can not vote with their conscience and vote towards the party whip regardless. So this is a huge strategic failure from people who market themselves as progressive, despite the fact that, like Rachel Reeves said, she wanted to be more pro benefit cuts. She didn't want Labour to be the party of benefits. The literal quote was, the Labour Party isn't for you if you're on welfare. And despite all these warning signs, they still got behind giving Labour this massive majority, meaning that there is now no opposition, both rhetorically and electorally, and within the House of Commons against this heinous bill, which, again, at this current time of recording, most people in the country don't support. But that number of people who don't support it will dwindle, the number of people who won't support it will increase the more that it becomes the political consensus. And that is the big problem with the entirety of this strategy, in my mind.
Yeah, it's very difficult once these kinds of policies go through to reverse them, although it is possible. But also with Rachel Reeves saying, I don't want Labour to be the party of benefits, which is another way of saying I don't want Labour to be a party of the welfare state. It's like, sorry, but Labour is the party of the welfare state. It invented the welfare state. That's a good thing. And we should stand by that. And if you don't want to be in the party of the welfare state, just be a Tory. But with some of these politicians, I really do think that they just decide they want to be a politician. They flip a coin and it's like, oh, Labour heads, Tories tails. Great, I'll just go wherever the coin tells me. And that's why so many people are dissatisfied with politics. Trump has announced a new 25% tariff on all imported cars, marking the latest escalation in the US-driven global trade war. The move will have particularly strong ramifications for the EU and the UK, but also Mexico and South Korea, who rely heavily on the US consumer market. The US accounts for nearly 20% of the UK's car exports, making it the sector's largest single market by country. And in terms of total market share, it is second only to the EU. Companies like Aston Martin are already seeing the impact, with their share prices falling by about 6% on Thursday. This is the EU's response to the announcement.
We want to build that relationship up, not tear it down. We are prepared to safeguard our economic interests, and if necessary, we will deliver a firm, proportionate, robust, and well-calibrated and timely response to any unfair and counterproductive measures from the US. I want to emphasise once again that our priority here is to find a negotiated solution, a solution that works for both sides, for the EU and US, a solution that strengthens our trade and economic relationship, which is by any distance the most valuable and important in the world. We want to build that relationship up, not tear it down, and we believe that the measures announced by the US go in completely the wrong direction.
Canada came through with some even stronger words, with Prime Minister Mark Carney saying this.
President Trump announced 25% tariffs against our auto industry. And this is a direct attack, to be clear, a direct attack on the very workers that I stood in front of, uniform workers I stood in front of this morning. You know, this will hurt us, but through this period, by being together, we will emerge stronger. I think what's happened, and this was part of our discussion, over the course of the last several months, Canadians as a whole across this country, have gotten over the shock of the betrayal and are learning the lessons. We have to look out for ourselves, and we have to look out for each other.
The UK offered a slightly more muted approach, with Rachel Reeves saying this.
Let's see where we get to in the next few days. I don't want to see tariffs imposed. I don't want to see tariffs go up. I believe in free and open trade, which is why we are in those intense negotiations at the moment.
Intense indeed. Trump responded to these statements by threatening even larger tariffs if Europe and Canada work together to cause, quote, economic harm to the US, for example, by imposing retaliatory penalties. Now, car tariffs have long been a cornerstone of Trump's America First economic policy, his calculation being that protectionist policies will bring car manufacturing back to the US, providing jobs. He's even calling the 2nd of April, which is the day that the tariffs come into effect, Liberation Day. However, there are some issues with this, of course, namely that his plan to implement similar tariffs on car parts in May will hit the US car manufacturers who rely on imported parts with higher costs. Now, it is clear that this is essentially a trade war. You can hear it there in the Canadian Prime Minister's language of this being a direct attack. And Trump's trade war is reshaping the global political and economic order away from neoliberal consensus and free trade to ruthless competition between global powers. And Trump is essentially banking on the idea that the US holds all the cards. They have the most guns, they have the most money, they have the biggest consumer markets, and they can basically use that to bring everyone to heel. And when you look at the EU and the UK's response, it basically amounts to, we wish he wouldn't do this, but we haven't figured out exactly what we're going to do in response. You know, they can put retaliatory tariffs, sure, but Trump just tends to respond with even more, like when he threatened to put a 200% tax on alcohol from the EU in response to the EU's plan to put a 50% tax on US-produced whiskey. So why are the EU and UK seemingly unable to do much but stand by and watch as Trump tears up global norms? Basically, why are we so afraid of Trump? The devil is, as usual in the details, in the form of something called a swap line. Now, swap lines are an economic whip that countries with powerful currencies use to get everyone into shape. They're basically agreements that exist between two central banks, for example, the European Central Bank and the Federal Reserve, that allows for easy and cheap access between two currencies in times of crisis. So basically, if the ECB urgently needs access to dollars to repay creditors at a time of crisis, they can activate a swap line to get immediate access to cheap dollars directly from the Fed. This was life-saving during the 2008 financial crisis when British banks didn't have enough dollars on hand to service its liabilities and, of course, couldn't print its own dollars because it only issues in pounds. It also came in handy during the COVID crisis when the US reopened swap lines to several foreign central banks to keep the global economy afloat. And these swap lines are possibly the biggest card that Trump has in his deck, the Trump card, if you will. A recent article in Reuters shows that the EU leaders are increasingly concerned that Trump will pressure the Fed to suspend what is an essential insurance scheme in order to bend Europe to his will. This would leave the EU and, of course, the UK in freefall in the case of another economic shock, as 17% of the Eurozone banks' funding is in dollars. And whilst the sources in the article stress that closing swap lines is a remote possibility, EU officials nonetheless are discussing how they can find alternatives to the US central bank. And this might explain why British politicians, who are even more vulnerable to swap line closure, are so submissive to Trump, whatever the cost to their dignity or to UK interests may be. And swap lines do work as an effective form of geopolitical bullying. As James Meadway pointed out in his recent episode of the Macrodose podcast, Argentinian President Javier Milei was recently brought to heel by the People's Bank of China, who forced him to roll back on a series of anti-China policies by closing their swap line to Argentina's central bank. And the chainsaw-wielding, hyper-mask strongman Javier Milei had a very quick change of heart following the move and will be visiting President Xi Jinping in Beijing later this year. Now, Helena, it's not news that the US is a global superpower and they aren't afraid to use that power to exert, geopolitical strength. But what I find interesting about this is that historically these kind of tactics have been reserved largely for countries in the global south and not to places like Canada and the EU, where this kind of gentleman's agreement and decorum means that these countries are kind of an exception to the rule. These blocs are an exception to the rule. There's sort of broader there's this question of allyship and special relationships that meant that historically the US would never use these kinds of tactics against Canada and the EU. What do you make of this shift?
I mean, it is interesting that we're getting lots of criticism of what Trump might be doing to the global order with these kind of aggressive trade wars with perceived allies. Yet when this, as you say, same kind of bullying was applied to the global south, no one really bats an eyelid. It's interesting where people's priorities are. And this is, of course, why the continued strength of the dollar as a global reserve currency has been used by the United States to bully these countries. And any attempt at divestment from this leads to, as we saw in Libya, the fallout that was inflicted on Libya by the American regime. Like, they were going to plan to have an African currency under Gaddafi in Libya to try and move away from the hegemonic nature of the US dollar. And America said they were going to invade, and suddenly it's now a country full of slave markets, right? That's what America can do to you if you don't obey the whip, as you say, right? Of how geopolitical power is weaponized by the United States to maintain imperial interests abroad. But what is important, I think, in my mind, is that these strong-arm tactics that you're seeing that have always been employed against the global south because of the strength of the dollar as a global reserve currency is something that you can very freely exercise against countries that have very little power. And that's what China have done to Argentina. As you say, they're a pretty small economy and an economy that's in pretty dire straits. They were in dire straits because of the failures of previous governments to get their inflation under control, and it's in dire straits at the moment because of Javier Milei just destroying their economy internally through stripping away a bunch of important institutions and government-funded departments. So it's very easy to strong arm and be able to bully these countries, but a strong economic bloc such as the EU and Canada, and if they manage to get more friends on board, if they, for example, get friendlier relationships with China, which it looks like we're seeing happen between countries like the UK and blocs like the EU. Sure, you may be able to get some short-term gains if you're the United States, if you're successful in bullying these larger trade blocs. Or if you push these people away, they might have short-term economic shocks by no longer having easy access to American credit, which may involve quite a lot of restructuring, a lot of short-term economic hardship, A lot of the benefits that you get from having a more beneficial trading relationships with these countries and with these blocs, in the long term, you'll no longer get access to, and you'll push them into the hands of what America perceives to be its geopolitical enemies, which is, of course, now China. They're far less likely to be antagonistic towards the Russian center of the world as one of the economic powers, because they're not even that powerful really in broad scale, but China is perceived to be, in Trump's eyes, the biggest threat. Sure, you may be able to strong arm your way to some preferential deals, but if you pull this lever too hard as one of the hegemons in the international geopolitical sphere, all you're doing is making people think, well, why would we bother? Why would we bother having this codependent and symbiotic relationship that we've had in terms of trade relationships for the past 70, 80 years, when we could just have more beneficial trading relations with China, who seem very happy to be engaging in mutually beneficial economic relationships with countries, not just in the global north, but also throughout the global south as well. They've been happy to do this. And when Milei wants to look towards the United States and move away from China, China's gone, oh, well, now we're going to start pushing the button. We'll start pulling the levers. So I think that there could be turbulent times ahead, but in the long term, I don't think this is a strategy that will work if the US wants to bully people who are collectively in a similar position in terms of power to them. I think that it's been a tactic that has only been successful at bullying small people. And if they come up against the EU and Canada, and potentially, of course, China as well, I don't think it will work as well. And of course, if they're putting tariffs to try and maintain a manufacturing base in their country, that's going to involve them putting in some kind of industrial policy to keep the domestic industries alive. And they're doing the opposite. They've got Elon Musk and Doge ripping through American state expenditure that's there to be able to prop up US businesses through supply side funding, which is what Janet Yellen was doing, or her strategy of the modern supply side economics was investing heavily in the manufacturing and supply side of the economy to be able to bolster it in a more kind of combative geopolitical climate. And Elon Musk and Donald Trump and all of their Treasury officials are all taking that all away. So I don't think that the tariff plan is necessarily going to turn out well for Americans either. Like, I'm not a free trade evangelist, far from it, but I recognize a mutually beneficial relationship when I see one, and I can see the tariffs only work when you have the policy to back it up, and Trump has none of these things.
Now, before we go on last night's show, my colleague Stephen Methven exposed how Sky News deleted this clip from the online version of a 10-minute interview with Jeremy Corbyn they'd aired the night before.
You say that anti-Semitism is evil, that it's wrong. You are also a member of the Independent Alliance Party.
It's a group. Not
a group,
party, yeah.
Yes, apologies, a grouping.
Yeah.
Just to look at some of the examples of people in the grouping, Ayub Khan resigned from the Lib Dems after being ordered to undertake anti-Semitism training, which he disagreed with. Adnan Hussein, at a rally in 2014, claimed Israel's military operation was a Holocaust. Mohammed Iqbal was suspended from Labour after allegedly making anti-Semitic comments at a meeting. I guess what I'm trying to say is, if you feel it is wrong that you have been expelled from Labour for these reasons, you're not really helping the case for the defence here, are you?
Now, as Stephen pointed out last night, Sophie Ridge smeared independent MP Iqbal Mohammed with completely baseless anti-Semitism allegations there. Iqbal Mohammed has never been accused of anti-Semitism, but someone who was another Muslim politician altogether. Mohammed Iqbal was a Labour councillor suspended from the party for anti-Semitism allegations, but was later reinstated. And that deleted question was in the original video that Sky News posted. They then took it down, edited it to remove it, and then reposted it without apologising or making the correction explicit. I guess they just hoped that no one spotted it. They couldn't have imagined our hawk-eyed Stephen would be monitoring their every move. You can't get away with anything while Stephen's on the case. But just hours after we aired our report, Sophie Ridge apologised. This is from her show last night.
Now, we wanted to clarify something discussed on last night's programme. During an interview with Jeremy Corbyn, we talked about the Independence Alliance group of MPs, and I made a reference to one of its members, Mohammed Iqbal, as having been previously suspended by the Labour Party for allegedly making anti-Semitic comments in a meeting. We wish to make clear that Mohammed Iqbal is in fact a councillor. He's not an MP, not a member of this group. Rather, Iqbal Mohammed is a member of the Independence Alliance group of MPs and did not make such comments. We want to apologise for this error and any confusion that was caused.
An apology for the confusion. I mean, it's not just confusion, is it? It's a smear against Iqbal Mohammed, caused pain, damage to his reputation. And also, it's a lazy and embarrassing line of questioning that Jeremy Corbyn once again had to endure from the best and brightest of Britain's dire media class. And of course, if you want to see that story in full, if you didn't catch it last night, then the link is in the description below. That was a long show. We went over by 20 minutes, but thank you for bearing with us. And thank you, Helena, for joining me today.
Always a pleasure, Dalia. I look forward to next time.
And thanks everyone at home for tuning in. Make sure you come back tomorrow for another live show at 6 p.m. Until then, you've been watching Novara Media. Good night.